So, is there then an age where seniors should stop driving altogether, or be more cautious, or that there, are there age-related boundaries or things that people should just keep in mind, if nothing else?
Everyone ages differently. That is, some older adults have major illnesses or chronic diseases that affect driving. As such, the older drivers many older drivers can continue to drive in their 70s and 80s and even beyond, whereas others who have major chronic conditions such as dementia or they've had stroke cannot or should not be behind the wheel. Some of the diseases and disabilities that may interfere with older drivers are vision impairment, strokes, chronic renal failure, Parkinson's disease, and certainly dementia, such as Alzheimer's disease.
Yeah, and so I guess the message here is there are people that could be driving till they're 100, and there's others that could have to stop driving at 65. Who knows? But it's probably not age-related. It's probably more medically related. And so if that's the case, then maybe the next question would be, what are some regular medical checkups that should be done when it comes to driving? How often, and what would those be, or what should those be?
So regular medical checkups, also referred as driver medicals, are compulsory in all provinces and territories in Canada. And these checkups include a physical exam, so checking for visual acuity, hearing, blood pressure, and whether the presence of illnesses such as heart disease, seizures, memory problems, diabetes, psychiatric disorders are present that could affect a person's ability to drive.
Is there something, and I know this is something that comes up a lot with our residents, where they say, well, does my physician just wanted to get me, he just wanted to take my license away. He was, I'm trying to remember. I remember a single resident. I remember this. It's so vivid in my head the day when this particular resident was kind of so mad about this. Where he's like, my doctor had it in for me. He was going to take my license away. He had to report it. He wanted me to come in for no reasons. And if I'm not mistaken, there's actually, at least in most provinces and territories, there actually is a requirement of physicians to report and do stuff regularly. What is that exact requirement, so that we can at least dispel this rumor that people's physicians have it in for them, they just don't want them on the road?
Well, before I answer that question, I think it's important to know, for physicians, this is probably one of the most difficult issues that they encounter with their older patients, because quite often they're very difficult conversations. So you're right, in most provinces and territories in Canada, physicians must report patients with medical conditions, so mandatory reporting of conditions that make an individual's driving dangerous. And again, epilepsy, dementia, Parkinson's, and that those reporting must be done to the licensing authority. So in Canada, provinces that are discretionary for physician reporting are Alberta, Quebec, and Nova Scotia, and the rest of the provinces and territories have mandatory reporting. And it's the licensing authority, not the physician, that makes the final determination of eligibility. This means, so this means that for the patient, if they've had an assessment and their license is revoked, they shouldn't be upset with their physician, because it's not the physician that revokes the license, it's the licensing authority. In Canada as well, driver's medicals are required on a regular basis, with the time periods varying across provinces and territories. And including an assessment of cognition is really important in that for illnesses such as dementia, their insight is impaired.